If you've been dealing with joint pain or chronic inflammation and someone has told you to drink green tea, you probably nodded and moved on. Because drink green tea sits right next to get more sleep and manage your stress in the category of advice that sounds right but doesn't feel like it actually does anything. This video is about why that dismissal may have been a mistake. Not because green tea is magic, not because it replaces anything your doctor has prescribed, but because there's a specific compound in green tea that has been studied in clinical trials with older adults with diagnosed joint conditions, with inflammation markers measured before and after, and the results are specific enough to be worth understanding properly. Here's what we're going to cover: the compound, what it does, and why it's different from what most people assume, the human research, what was found, in whom, and over what time frame, the honest limitations, because this isn't a cure and I'm not going to tell you it is, and the practical details, how much, how to prepare it, and what to expect if you add it consistently. 1 cup in the morning. That's the commitment. Let's talk about what it's actually doing. Green tea is made from the leaves of the Camellia sinensis plant, the same plant that produces black tea and white tea. The difference is in the processing. Black tea is oxidized, which changes the chemical composition of the leaves. Green tea is not oxidized, and that matters enormously because it preserves a group of compounds called catechins in their most potent form. The catechin that drives most of what makes green tea useful for inflammation is called epigallocatechin 3-gallate. Researchers use the abbreviation EGCG. You don't need to remember the full name, but you do need to understand what EGCG is doing that's different from anything else in your morning routine. Most anti-inflammatory approaches, over-the-counter pain relievers, for example, work by blocking a specific enzyme downstream in the inflammatory process. The inflammation has already been triggered. The cascade is already running. These drugs step in and block one pathway near the end, which reduces pain and swelling, but doesn't touch the underlying signal that started everything. EGCG appears to work further upstream. Your body has a signaling switch. Scientists call it NF-kappa B, that functions as the command center for the inflammatory response. When it's activated, it simultaneously triggers dozens of inflammatory processes throughout the body. Think of it less like a light switch and more like a circuit breaker that controls an entire floor of a building. Flip it, and many things switch on at once. Chronic low-grade inflammation, the kind most people with joint pain after 60 are dealing with, is partly a problem of that switch staying on when it should be off. Multiple studies have confirmed that EGCG suppresses NF-kappa B, not completely, not in every context, but measurably. And because NF-kappa B sits upstream of so many inflammatory processes, suppressing it has broader effects than blocking any single downstream pathway. The second mechanism is more specific to joints. Your body produces enzymes called matrix metalloproteinases, MMPs, that are designed to break down and remodel tissue. Under normal circumstances, they're useful. But when inflammation is chronically elevated, MMP activity goes into overdrive. They start degrading cartilage faster than the body can repair it. This is part of the physical mechanism by which chronic inflammation accelerates joint damage. EGCG has been shown in multiple laboratory studies to inhibit these enzymes. It appears to slow the cartilage breakdown directly, not just reduce the sensation of pain, but interfere with the process that's causing structural damage over time. This combination, upstream inflammatory suppression plus cartilage protection, is why green tea is being studied in rheumatology labs and not just recommended by wellness bloggers. It's a different category of evidence, and it's why the clinical trial results, which we'll get to next, are worth taking seriously. There are 3 pieces of human research worth knowing about specifically. The first is a clinical trial that enrolled 120 patients with rheumatoid arthritis, average age 60.7 years, all with established diagnoses. Patients were divided into groups: green tea alone, supervised exercise alone, and the biologic drug infliximab, along with combinations of those 3. All groups were followed for 6 months. Inflammation markers, CRP and ESR, 2 standard blood tests used to measure active inflammation were tracked throughout, as was joint count and a functional health assessment score. After 6 months, every group that included green tea showed significant improvement across all of those measures. Swollen and tender joint counts both dropped. The inflammation markers dropped measurably, and functional scores improved alongside them. And the group that combined green tea with supervised exercise showed greater clinical improvement than the group receiving infliximab alone. That's the finding that tends to surprise people, not because green tea is better than infliximab, but because the comparison was made at all and the results held. The second study focused on knee osteoarthritis, a different condition, and one where the evidence base for green tea is smaller and less definitive. 50 adults with knee OA were randomized to receive either a green tea extract tablet added to their standard treatment with diclofenac, a common anti-inflammatory drug, or diclofenac alone, for 4 weeks. Pain scores on a standard clinical pain scale showed a statistically significant reduction in the green tea group. Total WOMAC scores, the standard clinical measure for osteoarthritis symptoms, showed significant improvement as well, specifically in the physical function component. Stiffness scores did not change significantly. The conclusion was careful and appropriately modest. Green tea extract may be a useful addition to standard treatment, but further studies with larger populations and longer follow-up are needed. The third piece of evidence is observational rather than experimental. A 5-year cohort study following men over the age of 60 found that lower green tea consumption was significantly associated with a higher incidence of knee osteoarthritis. The association held after adjusting for age, weight, and physical activity level. Observational evidence can't establish cause. The men who drank more green tea may have differed in other ways. But as a corroborating signal alongside the mechanistic and trial data, it adds to the pattern. Now for the honest part, because this matters. The evidence is promising. It is not conclusive. Most of the human trials are small. 50 to 120 patients is not a large-scale study. Some meta-analyses looking at green tea's effect on C-reactive protein across multiple studies have produced mixed or null results, particularly in populations that don't have elevated baseline inflammation. The most compelling evidence is in rheumatoid arthritis. The evidence in osteoarthritis is suggestive but thinner, and none of these studies are long-term enough to tell us what consistent green tea consumption does to joint health over 5 or 10 years. What the research does support is this. In people with active joint inflammation, adding green tea to an existing routine produces measurable changes in clinical markers. Not dramatic changes, not a reversal of damage, but real, measurable, statistically significant changes. That's worth something, especially from something with this safety profile, this cost, and this level of daily ease. Most people managing joint pain after 60 have quietly divided their life into 2 categories: good days and bad days. On the good days, you move without thinking about it. You get up from the couch without planning it. You pour your coffee and your hands work and you don't notice them. On the bad days, you wake up before your alarm and you already know. Something aches before you've moved. The first 20 minutes of the morning have a different quality than they used to. A negotiation between what your body will agree to and what you need to do. You've learned to wait it out. You've stopped telling people about it, not because it doesn't matter, but because it's become background. It's just the weather. You've accepted this division as fixed. Good days happen. Bad days happen. Nothing to be done about the ratio. The research on EGCG suggests that ratio is not fixed. It's influenced daily by what you're eating and drinking, and specifically by whether your body has access to compounds that keep the inflammatory signaling switch from staying on when it should be off. You're not going to eliminate bad days. You're not going to reverse damage that's already happened. But the evidence suggests you can shift the balance, quietly, cumulatively, without medication, in a direction that makes more mornings feel like the good ones. That's a different kind of promise than most treatments offer. Medication typically works when things are bad. You take it because something hurts and you need it to stop. The cup of green tea works on the ordinary mornings. the ones that aren't bad enough to justify a pill, but aren't as easy as they used to be either. It's working in the background on the days you don't think about your joints. That's exactly when the anti-inflammatory effect matters most. Not during the crisis, but during the accumulation that leads to it. Green tea also contains a compound called L-theanine, an amino acid that works synergistically with caffeine to produce a calm, focused alertness rather than the sharp spike and crash that coffee can cause. For older adults who are sensitive to caffeine, green tea's content is significantly lower than coffee, roughly 25 to 50 milligrams per cup versus 95 or more in a standard cup of coffee. The L-theanine moderates the caffeine effect, which is why many people find that green tea produces a gentler, more sustained energy without the jitteriness. Drinking it first thing, before food, before the inflammatory inputs of the day begin to accumulate, means EGCG is circulating during the window when it can do the most work. By the time you've had breakfast, gotten dressed, started your day, it's already been absorbed and is active. The cup in the morning is setting a tone for the body's inflammatory state that carries forward through the hours that follow. That's how absorption works, and it's why the timing is not arbitrary. A few things about how to actually do this right, because there's one mistake most people make that quietly defeats the whole thing before it starts. Water temperature. Boiling water destroys EGCG. Most people boil a kettle and pour it straight over the bag, and they've just broken down the compound they were trying to get before it ever reached the cup. The sweet spot is 160 to 180 degrees Fahrenheit. If you don't have a temperature-controlled kettle, and most people don't, just boil the water, take it off heat, and wait 2 full minutes. That's enough. 2 minutes of cooling makes the difference between a cup that's working and one that isn't. Steep it for 2 to 3 minutes, not 30 seconds. That's not long enough to extract meaningful amounts. Not 10 minutes. That just makes it bitter without increasing the benefit. 2 to 3 minutes is where you want to be, on type. It matters more than most people realize. Matcha is actually the most potent option because you're consuming the ground whole leaf, not just steeping and discarding it. The concentration per cup is significantly higher. After that, high-quality loose-leaf Japanese green teas like Sencha or Gyokuro, and regular tea bags from a grocery store are lower in EGCG, but still meaningful. If that's what's accessible, it's fine. What genuinely won't work is the bottled green tea at a gas station or convenience store. Those have been pasteurized at high heat, usually sweetened, and contain EGCG levels that are too low to produce the effects we've been talking about. The label says green tea. The contents are a different thing. Don't add sugar. This one matters specifically for what we're trying to accomplish. Sugar triggers the same inflammatory signaling chemicals that EGCG is working to suppress. Adding it to the cup partially cancels the benefit. If the bitterness bothers you, a small amount of lemon is actually a better option. Vitamin C has been shown to increase EGCG absorption, so lemon works in your favor. On milk, adding dairy can reduce how much EGCG your body actually absorbs because milk proteins bind to EGCG and block it from being used. For this specific purpose, plain or with lemon is what you want. How much? The clinical trials that produced the most significant results were using 4 to 6 cups a day. That's not where most people are going to start, and that's fine. 1 strong cup in the morning, brewed correctly, is a meaningful addition. 2 cups, morning and early afternoon, puts you closer to the lower end of what the research showed, making a measurable difference. More than 4 cups isn't necessary. And if you have a history of kidney stones, stay within 2 cups daily. Green tea contains oxalates and the amount matters. 2 things to know before you start. If you're on a blood thinner, warfarin specifically, check with your doctor first. It's not a prohibition, just a conversation worth having. And if you're thinking about green tea extract capsules rather than brewed tea, that's a different discussion. High-dose supplements have been linked to rare cases of liver stress in a way that brewed tea at these amounts has not. Talk to your doctor before going that route. Last thing, timeline. The 4-week knee trial showed measurable improvements at 1 month. The 6-month RA trial showed progressive improvement across the full period. This isn't something you'll notice in 3 days. The mechanism is gradual. Give it a consistent month before you decide whether it's doing anything for you. Tomorrow morning, boil water, wait 2 minutes, steep for 3. No sugar, lemon if you want it. Drink it before breakfast while things are quiet. 1 cup, every morning. Let it accumulate. If this was useful, subscribe. I cover this kind of evidence-based practical health content regularly.